Welcome everyone. Wanted to remind everybody, you've probably seen it on the listserv, but the salary survey is live. And I know me personally, I really benefited from the data from the last salary survey. I feel like it's so helpful to be able to take that information and give it to those who make those decisions and kind of be able to make the case for the different things that are happening around the country and where our staff and where people fall into those salaries. So, um, also, I'm just a great big data nerd, so I feel like the more representative and the more ends you have, the better our information is. So, always feel free and share that so that we can get an idea of what's going on out there in our world. It's also, I think, really helpful because, in collaborative care, we're expanding and kind of adding different team members that are not your traditional mental health team members. I know our behavioral health care managers are bachelor's level um, folks. And so, that just adds another level of complexity and information that we'd like to have. Well, it's 5 after. We have 21 people.
We can rock and roll if you want.
Get started.
Awesome sauce. Well, thank you for those of you who are here. I know that sometimes it may feel like we're meeting inundated, but we want to have some opportunity today to really highlight the conference that's coming up. Hopefully, majority of you all are going. It will be in San Antonio, Texas this year. I just saw Neftali sent something out a little while ago. I haven't had the chance to read it yet, but I think he was talking about the ELOs that are taking place. But for those of you who may, for some reason, just not know, the conference is coming up. It is Thursday, October the 24th through Saturday, October the 26th in San Antonio, Texas. So thank you to our chairs this year who kind of got that rocking and rolling. And the ELOs typically happen that Thursday morning, and usually like the very first session after lunch is ELO, extended learning opportunity time, and then the formal kind of regular, if one could say, conference starts that Thursday afternoon. So we also know that everyone is not going to be fortunate enough to go to the conference, which is completely fine. Hopefully next year, you all get to hear about that, where it is. Maybe it'll be closer to your town and easier for you to be able to come. But we know that there are quite a few collaborative care sessions that are happening at the conference. And so we wanted an opportunity not only to talk about conference logistics, but also to allow some of our colleagues on the call to highlight what some of their topic areas are. As Tisha and I were looking through, there are quite a few of you that are going to be highlighting topics that we have heard people say they want to hear about. So it's always interesting to me. I don't know, sometimes y'all are just trying to keep all that great little knowledge to yourselves, or y'all are just a little shy. But a lot of the topics that are being talked about are things that individuals on this platform have had questions about or wanted to know more about. So we are hoping those of you who are on the call, who are presenting at CFHA, would be willing to share. Of course, and we know you're not going to give away all your tidbits, but willing to share what you will be presenting on and just a high level overview. I know everybody's time that they're presenting and all that. I'm a collaborative care stalker, so I kind of stalk who's presenting on what. I particularly like to see when I see new people, I'm like, oh, I'm going to go to that. So I know who all is presenting on collaborative care and where, because I tend to make that my priority when I go. But if you would tell who you are, where you're with, no hiding. That's right, Peg, no hiding. If you would tell who you are, who you're with, when your conference session is, and kind of a little bit of what you're presenting on. So that'll be our goal for today. And so before we get into that, Tisha, do you just want to give highlights about the conference and the dinner? I don't think we talked a little bit about the dinner, but not a whole lot.
Sure. I'll share my screen. For those of you who haven't had a chance, the website for the conference is great. It has some really cool little things you can do. So think go back. I put the link in the chat, and so you have the schedule. Um, Home just allows you to kind of look at the conference, kind of information about it, and then if you go to the agenda, it gives you kind of a real big overview, like uh, Monica had talked about Thursday ELOs, and then concurrent sessions start at noon, reception, and then poetry and prose that evening. Friday is sessions, group meetings. So at 7 to 8 o'clock in the morning on Friday, October. No, we're Saturday, aren't we? We're not Friday, we're Saturday. There will be some early group meetings. And plenary concurrent sessions. And then Friday evening, we'll show you, we are going to have our collaborative care dinner. It is limited space, so you can sign up on the website to have your spot. And then Saturday, from early in the morning, we will start bright and early, kind of talking about collaborative care and talking about our goals and things that we want to accomplish as a SIG together. And also, really, I think, want to take that time just to kind of get to know each other. It's very seldom do we get to meet in person. And so, get together and drink coffee together and wake up and meet each other. And then the concurrent sessions go until that afternoon. I think one of the fancy things that they have is with the schedule, and apparently my computer's going slow. Come on. Is that you can see each presentation by day and time. So you can go, and then so Friday night is our dinner. Where are we? There we go. So 7 to 9, CoCM SIG dinner at restaurant, and here you can sign up. And I'll actually just give you that here too. And the details of that are here. Yes, we're going to be at Domingo Restaurant on North St. Mary Street. It's within walking distance. Oh, we've got some people who are signed up. So you better get your spot while you can. But I'm really excited about this, and would love to hear people's feedback for how we can do it big again next year. So I clicked on something. Also, a great thing that you can do is you can filter sessions. So, filter by collaborative care. You can see all of the great sessions that are happening. So if you don't say something, we might just start calling on people. So just know we can filter. You can filter by your name. So I can filter by myself. You can see me when I'm doing things. Oh, I'm going to dinner. I'm doing other stuff. Or by description. So it's a great way to kind of play around and filter and learn about different things.
I think the name is the name of the session.
Yeah.
Oh yeah, and otherwise a speaker.
Filter by speaker. That's me. I'm in there somewhere. So, other things, questions, Jackie could could give you some more information too. There's going to be an app, so it will have this information too. But if you're a planner like me and Monica, you can start to use your free time to anticipate the excitement.
I'm gonna throw other people under the bus too, or Peg, because Peg is over there doing the same thing we doing. Jackie, anything you wanted to add from a logistics standpoint for the conference?
Yeah, so this year I think the app is going to be a little less robust than, I mean, it has just as much information, but it's not quite as pretty as the one we've used in the past, but it's the same system as this whole program that's on the website. So if you were to go back into your registration and select the sessions you're interested in, they will carry over to the app. So you can do that on the app or you can do it down here. I do have it set up. You can select more than one session time, more than one session at a certain period, because I personally like to say all the ones I'm interested in, not just the exact one I'm going to go to. So just so you know that that's there, that information. Hopefully you can see the attendee list. There's a page on the app also where it says register information. It has restaurants, it has some different things that are going on in San Antonio. And then there is a spot if you're logged in, but some people have had trouble with it. So I have to play around with it a little bit. The other thing, there's the Day of the Dead celebration is, it's usually right before Halloween, but the Friday, here we go. It's happening the Friday and Saturday. There's things going on Friday. There's a parade, and then there's stuff on Saturday and Sunday also. Right down there in San Antonio, and we're right on the riverfront. So if you haven't been there before, it's a great location. I went for the very first time like 2 weeks ago. So, any questions? And if anybody like wants to add a discussion group or you wanted to add an ELO to your session, you can just let me know and I can help you with that.
If you want to look at the menu, Domingo's is on the list of restaurants, so you can go ahead and start planning.
I actually went there when I was there for the weekend, and it was delicious.
I was
And
gonna say,
right on the
please tell us
water.
it's good.
It was right on the water. It was so good. And I would suggest when you walk over there, don't just like, if you haven't been to San Antonio, I think everybody like pictures it as the waterfront, like if you had images, but it just looks like a city, like on ground level, but then down one level is like where the waterfront is. And like my husband and I walked over to Domingo's, like following our app, and it was like on the street, and we're like, I was like, we have to find that waterfront. And then when we got there, we realized it's right on the waterfront. So we walk back that way, and it's a totally different experience. It's like walking in the street and when it's hot, or pretty tree lined area. So but yeah, the restaurant was delicious.
Nice. Give us something to look forward to.
I think there's gonna be plenty down there. So
Gotcha. Thanks, Jackie. We appreciate you. Small staff, but mighty. All right. Well, if no logistical questions for Jackie, I did put the link in the chat box for those of you who are going to be at the conference and want to join the dinner on Friday night at Domingo's from 7 to 9. And then, of course, Saturday morning is our SIG meeting, super duper early. So we hope to see you there too, bright and early. Bring your coffee. Or if you're like me, I don't drink coffee, but I'll bring hot tea. So I know from the names that I see here that there are people on who are presenting. I am so willing to volunteer you, because then I'll just hug you all when I see you for forgiveness. But anyone willing to go first with your presentation? Oh, oh, Kristen, I was getting ready to say your name too. All right, Kristen. I'm
Yes.
excited. I'm excited. I was excited to see your name up there and your crew. So tell us where you are, who's your crew coming with you, and what you guys are going to be talking about.
Yeah, me too. So thank you for the introduction. Monica introduced me to, she's not on the call, but Gretchen J. Cox at Novant Health. She is doing integrated behavioral health in a women's health setting. So she and I, along with some colleagues, are co-presenting on facilitators and barriers to success in IBH generally, but CoCM specifically in a women's health setting. If those of you that were on the vendor call, I work for LifeStance Health, and so we are launching, in the process of launching with the collaborative care model with an OBGYN group in Florida. It's been a really interesting experience, definitely a different culture than primary care in many ways. And so while there are certainly some consistencies when thinking about just the startup and implementation, and then kind of the ongoing management of these programs in general, and then the nuances with women's health. So I'm going to talk about that part, the sort of start part, and then the Novant folks, they've been doing IBH in this setting for 5 years now. And so they're going to present some data on their program thus far. So multidisciplinary presentation with myself, and then I have an operations/finance person that will be presenting with me to talk about sort of the business model of this. And then the Novant side, it'll be Gretchen, and then we have the psychiatric consultant who's presenting, as well as one of the OBGYNs that she works with. So hoping to be able to, in a very short 60-minute presentation on Saturday, deliver on all perspectives. So I'm really excited. I'm grateful for the opportunity. And again, Monica, thank you so much for the introduction. I feel like it's a much better talk now that we're all going to be there. So thank you.
I mean, it was going to be amazing anyway, Kristen, but I love connecting people who have similar interests. And I know that it does feel like 60 minutes, like it's not enough time, but it at least opens up the discussion, I think, down a lot of different avenues, whether it's the financial piece or just the population focus, right? Because you're right, it is a lot of different nuances when working with women's health, and then in particularly, the OBGYN factor, and a lot of perinatal stuff is coming up. So I'm excited to have you guys present and see where it goes and what other connections you make. I think that is the other beauty thing that I love about the app. I know I haven't seen the new app, and Jackie said it's not going to be as robust, but I remember like highlighting people's name in the directory of like, ooh, I need to make sure I stay in touch with this person and that person and this person, for all the different reasons. So I'm excited to see what your session brings and some of that population focus, because I think that we do. I actually was pleasantly surprised to see there be a lot more around certain populations, providing collaborative care with certain populations, because I do think that that doesn't get highlighted as much. So
Yeah,
that's,
like how do you be a generalist and a specialist? Like you're both things in these
yeah,
situations. So it's pretty
yeah,
interesting. So
gotcha. Thanks for sharing, Kristen.
And I also think that that the population is just, it's such a foundational population to take care of, and to for just prevention of things, with the babies that are born, and with just the long-term health and well-being of our entire population. And so when we can support women and families during that time, you just are making such a big difference. So it's amazing. Great work.
Who else is going to be brave today? That's like always. Oh, Pig went too.
I was like, I'll be a little brave.
There you have
Supposed to
it.
be.
You go, Peg.
I'm
Pig.
incognito, Beth, because on the schedule, I'm there with my formal name. So don't ever call me Margaret, because I think I'm in trouble. It's always Peg or Peggy is always good. So I'm from the VA. I'm Peg Arnett. I am the clinical education program manager for the Center for Integrated Healthcare. I'm going to be there with Dr. Martin and Dr. Mitzel. We have 3 presentations this time. We put all 3 of them in and we said, well, we'll see which one drops. I mean, all 3 of them did, and we were super excited to be there with you all. So we're going to walk folks through some changes that we've been doing with our competency training, our integrated care training that's been around for a while. Perfect storm of things happen, and we really wanted to focus on our collaborative care managers. A lot of some data came in about the sustainability of those particular programs across VA being less than our integrated behavioral health programs, and all kinds of other things happening at the same time. The launch of the suicide hotlines brief number, knowing that we're the front door for mental health care, and knowing that we needed to get really collaborative care management in all our sites of care. So we needed to focus there. So my presentation particularly is going to be about our asynchronous learning and all the changes that we've made to it, including adding learning groups, specific groups that we asked the field, we asked 8 million people, like, what do we need to do here? What do we really need to teach? What are the skills that you find that our CoCMs are struggling with? And made learning groups to expand on the asynchronous kind of materials and bring like the meat and bones of what we're doing with lots of fun and lots of practice. So we'll share some of the innovative kind of training things that we're doing with our CoCMs. And some of the data that we're getting after they're going to their live training, where they have to do role plays for certification, and how that's all impacting it. So we're happy to share what we've learned with everybody.
I find that the behavioral health care managers are wanting more, like just more and more and more, right? Like so I'm interested to hear kind of what it seemed like you all would be presenting, like some of the feedback they've provided to you and what they're interested in. And so I'm excited to hear that on a
Yeah.
personal level, but then also like professionally with the AIM Center. Like, okay, well, what is it that they're needing and they're wanting, and bringing that voice into the work that we're doing, because they're the individuals we serve, right? Like not just our patients that we're all working with, but
Absolutely.
yeah, they're individuals.
Absolutely need to be sensitive. And we were hearing threads for a while from our trainers, from our leads, from them, and it all kind of came together. And so it's a very tiring couple of years to get there, right? With all the iterations, because we are those people that are never content. Like we're like, that could be better. How can that be better? Let's change that. And like developing handouts in the middle of a train. I mean, it was a lot of intensity to make sure that we got them what they needed. But that's like always my heart, right? I want my care managers to leave training saying, I know what I'm doing, I know how to do it, and I know how to do it well. And so we wanted them to leave with that confidence. And they had a lot of fun. So we try to have some fun while we do some training. So hopefully y'all enjoy. I'm super excited. It's my first time at CFHA. Unfortunately, I do have to leave early because my daughter's a senior, and the big band thing, senior night, is of course
Oh.
that Friday. Makes me want to cry. But I am gonna make the best of it when I get there early Wednesday. I'll make sure to try to tack y'all down, because if not, I would totally be at that dinner with y'all. So I want to make you know, totally be there.
Gotcha. Gotcha. Like all the different hats that we wear. No, same. I was like, oh, I want to be able to stay all the way through the end, but it kind of depends on if my son's football team makes the playoff, which I want them to because he wants to, but then I want them not to because I'm over it. But hey, we'll see what happens. We'll see what
I hear
happens.
you. I hear you, Monica. I was like, of all Fridays, that's the one Friday, just not like, can it be the fourth? I was like trying to like, how many coffees or cookies is it gonna take to move it to
Well, you will
not
make the
successful
best
about
of it.
negotiations, but I will make the best
Yeah,
of it, and I'm really excited to meet everybody.
good stuff. Beth,
Hi.
hey, hey.
So I'm Beth, Zyma Schreider, Chief Behavioral Health Officer at Access Community Health Centers, and I have 2 presentations. One with Tisha, whoop whoop, to really talk about advocacy efforts and the inclusion of the integrated behavioral health codes, and going to be talking about obviously what we're doing in Wisconsin, but Tish is going to talk about what's happening in Arkansas, and hopefully also just share some information and talking points and things that we did related to advocacy so that others don't have to reinvent the wheel, right? And if there was some good messaging and things that were helpful, really, I think CFHA is all about sharing and growing and supporting that spread. And so that's one of the aims of that presentation. Tisha, anything you want to add to that?
No, just I'm excited. I think we've got two stories to tell, and they're really interesting stories, and I think they'll apply to other people's stories. And also, I've got a lot of experience in advocacy and talking with legislators and people at all different levels of government. So I'm just and it's something that I can talk about all day long, every day. And so excited to share some of those experiences and help people think through their challenges and opportunities in their states. So we're just really excited to get the opportunity to share our stories.
And I think Tish, we connected here, right, on the CoCM SIG to say, oh, let's present together and kind of elevate those collective experiences. And I just think, again, that's a testament to the SIG and how it connects a lot of us from all over the country with similar work. So the other presentation that I have is Amplifying Care Impact is the title, and a case study on integrating CoCM within an established PCBH program. So Access began as PCBH back in 2006. So early adopter, right, around PCBH, later adopter when it came to CoCM, so August of 2023. But really, how do you make those two models work seamlessly together and bring out the best of both to really make sure that nobody falls through the cracks, right? And that primary care is covering the wide range of presenting concerns and challenges. So I'm really excited about that. And one of the big things we're going to hit on is our care managers at Access are actually bachelor's trained. And so what does that look like to have bachelor's level care managers working side by side, right, with your other LCSWs, licensed psychologists, and really creating career pathways? How are we diversifying our workforce and ensuring that there's a seat, I think, at the table for everybody, and that we're really harnessing our collective power as care teams to partner with our patients?
That's the part I'm excited about. I am a licensed individual. I'm sure many of you are as well, and nothing against us. I just think that the field is big enough in terms of how we can work and partner together. And there are a lot of individuals now in collaborative care that have shared models. I don't know if I should call it models, but shared roles, I guess is what I should really call it. Shared roles and responsibilities where people are figuring out how do we use our bachelor's level individuals? I know here in Washington, I say here in Washington, I'm physically in North Carolina, but here in Washington in my head often, we just had some bachelor's level certification go through from a state policy standpoint for a position called a behavioral health support specialist. So I just think that the more that we are thinking about our field as a whole and how we collaborate with each other and people that we bring onto the team and how to make that work, it just always excites me. Always excites me. So excited to hear how you do that. Beth, now I know there are a lot of people who are going to be interested in coming because the seamless word you use, how to have collaborative care and PCBH work seamlessly. I was like, ooh, okay.
Role definition, role definition, role definition. I think that is the biggest thing for clarity, like role definition. And one of the things we're going to talk about is for us, because we've had PCBH for so long, I could not tell my providers, like, do something different. Like for us, it was you go to your friendly neighborhood BHC, and then we're actually the ones that are helping funnel to CoCM because we need them to have a very clear point of entry and that there's no wrong door. And so it's always, when in doubt, refer to your neighborhood BHC.
Yes, Peg put it in the chat, the workflows, right? If you start trying to have providers figure out, okay, if it's this, then do this, and if it's this, then do this, you're going to get nothing. That's what's going to end up happening. So,
yes.
yeah.
It's like
Good stuff.
paralysis because there's too many decision points. And so then I make no decision point. So instead, when in doubt, refer to BHC and then we will figure it out from there.
Love it. And when is your, I don't think I even asked everybody when their, well, I know when your sessions are. When's your session, Beth?
That one I think is Saturday, 1:30 to 2:30.
Okay. Okay. And the one, Tisha, the one you guys have together?
Thursday.
I was gonna say, do you know when it is, or do you just show up? Show
No,
up
the
and
one
everybody
that
else
one
will.
is Tisha, you better show up. It's Thursday, from 1 to 2.
Okay, Thursday from 1 to 2. Okay. Peg, when's yours?
I am still working with Jackie because I had to, because of the flight
Oh,
issues,
that's
I
right. That's
wasn't
right.
able to leave. So I think mine's gonna be cut down to half an hour, which is fine. I'm Cuban and from Jersey originally, so I could talk fast. And y'all get the slide, so it would be good. So I think it's gonna be, I think early afternoon, like 12 something for half an hour. I think that 12:15 to
On
12 something
Thursday?
on Thursday.
Or,
And,
okay.
and
We'll
Peg,
have
you and I can
another
talk.
one.
You and I
Yeah,
can talk
exactly.
again because I might have other space. So let's talk after this.
Jackie's a miracle worker. Watch and see what
I figured.
happens.
I know
She,
she is. She's been such a
she has a
saint.
special wand. We don't get to see it, and she only
But
waves it when
and she's got that
necessary. But
time turner. I think she also has that time turner, right? That the Hermione time turner that she makes magic happen. So Beth, I'm super excited because we went through a lot of this transition with our folks as well nationally. Like as we again CoCM, we were like, hello, the evidence base, huge. Like you can go everywhere across the system of care. Let's get this out there. It was really helping folks, even our PCBH folks, to remember it's on the table always. So for depression care, it's always should be one of the things that's on the table. And then talk to the veteran and see where they want to land. Do they want to work with you on a brief protocol, or do they want to do some work with one of our CoCMs? And that also then freed our integrated behavioral health folks to do other things, to get more into like the population-based care related to diabetes and hypertension and all those other things that we want to get our hands into that we sometimes can't because we're tied up. So yeah, that's awesome.
yeah,
If I'm not at the same time that you are, I'll definitely go over and peek.
gotcha.
What you guys got going on.
Kristen, when is yours?
Saturday morning, 10 or 11, one of those.
Okay, early Saturday. Gotcha.
Mhm.
Ben, hey.
Hey Monica, how you doing?
Doing well.
Update, my daughter got married. It was wonderful.
Choo-choo-choo.
I'm not
You
speaking.
survived. I should be saying
did.
that, huh, Ben? You
Oh no,
survived.
I'm waiting for all the pictures of me crying. I'm not speaking, but I wanted to give a shout out to a past colleague of mine, Hugh Barrington, from Mira. So as you may not know, I did a pilot in pediatric behavior CoCM and then sold my intellectual property to Mira, then worked with them for about 18 months to develop a collaborative care registry. And so he's talking about you can't just throw software at a problem. And Hugh is English, he talks fast. It's going to be a great presentation. He's incredibly intelligent, so check it out.
I love the folks at Mira. Ben, when is that one?
Oh, geez.
Oh, wait, let me see.
I had it open,
If I
but I
find
didn't look where. Oh, maybe I can find it. Friday at 10.
Friday at 10. Yeah, I think it's, as we talk about not maybe having time to do some of the other things or involve in some of the other topics, that's one of the things as the topic that you're talking about, that's looking really at not just the logistics, but really like the measurement based side of all of this. Like sometimes in the implementation, and there's things ebb and flow in implementation and the hiring and the onboarding, all of these things, that it gets really easy, I think, to stray away from the foundation of why we're wanting to do this anyways, to help our patients, and being able to do that, to have that measurement based piece of things be our cornerstone to drive decisions and what we implement and what we tweak. And some of those pieces, I think, for so long are integrated care in general, has oftentimes not been always seen by other colleagues as I was going to use the word valid. That might not be appropriate. So you all and those who are watching, give me a little grace, but may not have always seemed as valid or as important of something to look at because they thought we didn't do measure. We just did talk therapy and we just sat and we just talked and like that was just it. And so I think the more that we are engaging with other disciplines, we're looking at measurement based, we're looking at how to track these things because we're trying to work smarter and not harder. I think just the length and levels of collaboration I've seen with individuals has been amazing.
Yeah, and it was a very fun experience, something I'd never done before. And they really listened to us clinicians that time is important and ease of documentation is super important and multiple respondents and respondent percentages. So yeah, so I'm no longer working with them. If anybody has a job, let me know. But I left in good graces, but they're a great organization.
Awesome sauce. Okay, let me find you out on the market, Ben. Okay, that's a side combo. Ben, are you going to the conference this year?
I am. I
Okay,
am.
okay, good deal. Anyone else on the call? I will say, I forgot about myself. So I am presenting with my colleague, Annie McGuire, who's not on the call today. I actually think she has two presentations. She and our psychiatric consultant lead, Jesse Whitfield, are doing an ELO around systematic caseload review, where they're going to be diving more into streamlining that process, making sure that process is not just time specific from a standpoint of business and finances, because we still have to worry about business and finances, but really also from a clinical standpoint, like how are you really maximizing that time and making sure that you have systems in place where patients aren't falling through the cracks. And just some tips and tweaks that they have found over the course of the time that help that systematic caseload review time go well, from a behavioral health care manager standpoint, but also for a psychiatric consultant standpoint. One of the data pieces, I'm thinking about bringing data in, as Peg was saying, that we had gotten from a lot of our psych consultants is, other than that initial training, there's not a lot out there for them in terms of how to do this. And this is not something that is been around for decades for a lot of psychiatrists. So that putting on that hat of consultant versus seeing the patients face to face and how to turn off that I need to know all of these things in order to give recommendations, like just how do you do that safely and how do you do that soundly as a psychiatric clinician and some of those pieces. So they'll be talking about all of that at their ELO. Annie and I are doing a session on, and I'm going to put this in quotes because we've been having some discussion about the word, but relapse prevention planning or wellness planning. People call it maintenance planning, whatever you may call it. But we really want to go dive in a little bit deep beyond just the generic that people know about it in terms of how to start that conversation earlier on with patients, not after, yes, resiliency promotions, sure, might take it. All the different terminologies, because there's a lot out there, but we want to talk about that and we want to talk about how you highlight that with patients and how patients begin to utilize that way before they are in what some would consider to be remission. So we want to be able to have that conversation about what that looks like, how to tailor those actually to the patients in front of you. We know lots of individuals in our training that have different templates and all of that, and those things are great. The downside sometimes though with templates is you aren't able to really tailor those to the person that's sitting in front of you. And so how do you make sure, based on the patient population that you're working with and the patient in front of you, that you are making sure that even those relapse prevention, resiliency promotion, wellness plans are still very much patient-centered. So we'll be spending some time talking about that. And I just drew a blank about the when, but I believe it's Thursday afternoon. I just can't think of the exact time. Thursday afternoon sometime.
I love that conversation, Monica. I just had a conversation with my care managers. Mine has had a little bit of, I don't know, challenge with patients once she starts talking about relapse prevention. All of a sudden, their scores start going up. Um, so thinking about the wording that we use and how we frame that early on, and not let it seem like a scary thing to patients. So it's
Yeah,
exciting.
absolutely. We're excited. We're excited to be there and do it. And Annie is from Texas, so we're also excited to kind of be in her hometown there. So it'll be good time. I'm looking. I don't think I did. Did I miss anyone who's on the call who will be presenting? I don't think I did. I think I snatched all of you guys.
My other
Uh,
presentation is about collaborative care, but it is focusing on, long story short, working on developing a training and kind of the results of a training of trying to work with our social workers in our group to kind of move from a social worker identity to a behavioral health consultant identity. And so kind of thinking through how we kind of developed a training, what we did, and some of the results around that. So that's one of the things we're going to talk about.
Hey,
Hey,
good afternoon.
Jason, how are you?
I'm good. How are you doing?
Doing well.
Excellent. Yeah, I actually my group is going to be doing a presentation at the conference. We're really excited to be joining you guys down in San Antonio. Um, but yeah, I just wanted to briefly introduce myself. I'm Jason Ono. I'm based here in Chicago, Illinois. I'm part of a group called Woven Clinics, and my colleagues and I just finished our residencies and really decided to venture out and start a practice on our own and really focus on collaborative and integrative care to increase access. And our focus is going to be really talking about the experience of early career psychiatrists in this space and talking about what that looks like from gain exposure and graduate medical education to all of the challenges and pitfalls and things that we've learned early on in setting this practice up. So really excited to get there and meet everyone and pick your brains about all of your experience.
Well, we'll be excited, Jason, to hear about you all's experience. That was one of the, I don't know if you were on when I was saying that was one of the pieces of feedback that we continuously heard from psych consultants is just like, this is new, right? Like, yeah, we know medications and management of Medicaid like that, yes, but this is new to be in this consultant role and some of the systemic things that get in the way. And how do you manage that and how do you handle that? Like those things are new. So I think it's exciting that you guys will be doing that presentation and a lot of psychiatrists who will be at the conference and who are interested in either embarking down this road or already on it will be excited to hear from you all.
Yeah, no, it's going to be a lot of fun. And those are some of the questions that we're answering. You know, I come from a public health background as well as being a provider and thinking about how I've integrated that. Luckily, actually, I'm not going to give y'all too many spoilers,
Don't give
but
us
I
all,
am
don't
looking
give us
forward to
all the
sharing
tea,
it.
just a
Yeah,
little bit.
yeah, just a little bit so y'all come over and see what we're talking about.
Okay. What time is that session, Jason?
That is a great question.
Okay.
That is a great question. I don't think I have that information. That might be one of my partners, but I think they are working clinically right
Gotcha.
now.
Gotcha. Okay. We'll have to
Jason,
be out on the lookout for you. We can filter by name. We got to see that earlier. So we'll have to be on the lookout to make sure that we get the extra tidbits that you'll be sharing during your session. Thank you.
100%.
can I ask a question, Jason? Are you guys child psychiatrists, adult, or both?
Yeah, great question. We are primarily adult psychiatrists. We're actually working right now to bring in some assistance to handle a child. You know, there are some things that we're comfortable with, but we definitely are adding that expertise to get the full range because we know primary care, seeing the full gambit, the full age range. So trying to really cover all the way from child to geriatric.
Thank you.
Gotcha. So
Yeah, no problem.
Jackie, Jason, you'll be glad to know that Jackie, who has the magic wand, when you all see her, refer to her as Jackie, the fairy godmother. So Jackie has just
Understood.
said that your session is, oh, I just lost it because somebody posted something. Hold on. It's Saturday at 11:15 a.m.
Perfect.
Okay, let's see. What are you, Peg, what are you saying about the panel?
So on Thursday, we also have a panel discussion, myself, Luke, and Jess. So we're on the education side of the house at CIH. Are also going to be sharing like a bunch of bells and whistles that we developed like things using like animation, other things that just kind of capture people and engage people in learning. So we have a bunch of bells and whistles that we'll be sharing with you all as far as things that we've been using throughout all our competency trainings. And so it's an opportunity for folks to kind of ask questions, share also anything that they may have going on. So just to give, again, just kind of broaden our eyes and our ears to just how we train and how do adults learn and how can we make this fun again.
Yeah.
It'll be fun to just see some of some of the goofy things that we came up with and some of the fun things that really stuck, like the uses of metaphors and other kinds of things. So might be helpful for folks as they think of training their staff and developing trainings for folks who are coming in. So
Absolutely helpful because we all learn so differently. I love when Peg says to make it fun again, because as I use a lot of learning management platforms, I love it when I complete something and the unicorn comes across my screen. So yeah, whatever it takes, those little tidbits that keep
right.
people engaged and all of that good stuff. So yeah.
You'll see us. We play a version of a game show that sounds like Jeopardy, and all kinds of goofy things to teach people MI skills. And so again, it's that thinking out a little bit differently to make sure we're engaging folks in learning, and you just learn differently sometimes when you're in that kind of space. So
Yeah. What time is that one, Peg?
oh, I would have to check. I think that's a 1 o'clock on Thursday, the panel, and then on Saturday we have another one on our on our live training and how
Okay.
we're some things we've done with that one. So
Gotcha. You all didn't know that this was going to be a pop
no,
quiz on when is your session.
no, and I told my daughter who just got home from school because I work remotely, I'm like, do not come crashing into this door looking for cats. So unless you want to be on camera and say hello to all the nice folks here from CFA
We
across
take it. We take it.
the
Tell her we
world.
said hey, and she better rock out this weekend. Kim, I thought I saw you come off of mute.
You did. Hey,
Hi.
yeah. Oh, that's another Kim. There's two Kims.
There's two Kims. I take you too, Kim Kuman.
This is Kim Schuler from Arkansas Behavioral Health Integration Network. Nice to see everyone. I just wanted to give a shout out to Dr. Anofaha Jason. I'm sure I'm mispronouncing your name, but we're hoping to bring you to him to Arkansas. We're working on that piece right now, actually. So really excited about that. And we're also hoping to develop some new training pieces for the psychiatric consultant with Dr. Sideri. So that's coming. We're not presenting, but just wanted to give those two pieces of information because I think those are exciting updates that are on the horizon.
They are. Psychiatrists Unite. Y'all are going to be like superheroes.
We're excited to be joining you down in Arkansas, Kim.
Good deal. Are there any last, because I want to be respectful of time and transition time. I am not trying to be, I am going to be better about that in my years going forward and months going forward here, about allowing transition time for individuals to prep for their next thing and bio breaks and all of those good things. Anything, questions or anything pressing that we can maybe answer before the next time we all see each other, which most of us will be at CFHA and some of us will be next month.
So I just want to remind everybody that next month, what we'd love for everyone to do is really bring your aha moments, the things you learned in the different sessions that you went to, so that we know that not everyone's going to get to go to all the sessions they want to. And so if we can use this time to teach each other the things that we really took away and that we're going to implement and the things that we learned, then we can make the most of the conference. And then those who weren't able to be there get to learn along with us.
Sounds like a plan. All right, you guys will have an amazing rest of your day. See you all in a couple weeks.
Bye-bye.
Take care.